So I'm gonna ask you. I think everybody wants to be curious. You know, I was um, psychiatry. Why did you pick that specialty? I mean, and you were different. Like I said, when I met you, I was like, this brother's going into, and you were very clear. I'm going to do adolescent psychiatry, which is, and
Mhm.
tell us how you, what the training is.
Well, in order to become a child and adolescent psychiatrist, obviously you go to medical school, and so many times people will confuse what is a psychiatrist versus a psychologist.
Mhm.
And so the thought is psychologists have a PhD many times, and a psychiatrist has an MD. So you have to go to medical school, which means that really you need to be a good student in high school, you need to be a good student in college. And really to be a good psychiatrist, you really need to be interested in people, and so I would say my exposure to mental health was quite young. I know my mom would make the joke that if the family would have had heart issues, I would have been a cardiologist. So
Mhm.
the fact is that I was exposed to mental health inside the home. My grandmother was schizophrenic, but
Mhm.
she was a very functional, loving, caring individual who
Oh.
who also would hear voices and things of that sort. So, when I went to medical school and you would see people who were struggling mentally, honestly, to me, I wanted to run to them, but
Right.
a lot of my peers wanted to run from them. And I just thought that some people heard voices and sometimes may act a little different or erratically, or may misjudge and misread a situation, but they're still just regular old people who do things a little bit differently. And so that was always my interest. Now, when it came to adolescent health, it was just, I'd done some work as a high school teacher, a substitute teaching
Mhm.
between undergrad and medical school. And I think that probably grew my interest in that particular area. But the fact is that I trained in child, and I liked treating young kids is just as much, and I was really surprised to find out that, helping 5 or 6 year olds, or be it 15, 16-year-olds, was just as rewarding. And then also you have even, I've done some nursing home work and all that. So I see the full spectrum. I still have an interest in that middle age there of adolescence, early adulthood, but all ages. And really, all of us are on developmental stages.
Mhm.
Everybody's in a developmental stage, be it 5 or 55 or 85. We're all in our different phases in life. And
Mhm.
so trying to help people make sure that they attain all that they can be, treating mood issues and depression and bipolar and erratic behavior, sadness, feeling down, a lot of anxiety right now. Seeing a lot of anxiety with your students, those who are going to high school, fearing getting ill, fearing bringing it home and getting folk ill there. Those who are isolated at home, not being able to be around your friends and congregate. All of those things are really going into the situation right now, which makes even, my love of what I do even more, trying to help people cope with
Mhm.
everything that's going on.